We want to go to another story that's getting plenty of strong reaction this afternoon. Health and Human Services Secretary Robert F. Kennedy Jr. announcing that he's cutting $500 million in vaccine funding. Now, that includes projects to fight respiratory viruses like COVID-19 and the flu, including avian flu. It also comes as HHS cut a $600 million contract with drug maker Moderna to develop a vaccine against bird flu. Scientists around the country are sounding the alarms, saying mRNA shots are the best option to protecting the country from another pandemic. Scripps News business and tech correspondent Maura Barrett is live for us in Chicago. Maura, a couple things. Remind us, one, how mRNA vaccines work, and also, what does this move by RFK Jr. mean for the future of vaccines?
Well, Nate, the best way that this was described to me by a doctor at one point is that the mRNA vaccines work essentially like a Snapchat message. It sends a genetic instruction into our body when we get the vaccines, and it directs our body how to fight viruses, and then it disappears, just like those messages that we're familiar with. And now what Health Secretary RFK Jr. is saying is that this is not reliable, and he is asking his departments to look for alternatives in terms of vaccine strategies. But medical experts that we spoke to today said this is not correct, that the science is strong in this, and they worry that this could impact advancements on those annual shots that we get each year, like our flu shot.
Massive federal funding cuts could impact vaccines in the future. Health Secretary Robert F. Kennedy Jr. announcing Tuesday nearly $500 million worth of cuts for mRNA vaccine development.
Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract.
But multiple vaccine experts tell Scripps News data does not show that.
That's not what the science shows at all. The science shows that they are effective.
So the mRNA COVID vaccines are probably, at this point, our best studied vaccines. There's been billions of doses that have been administered, and what have we learned? We've learned that they're remarkably effective.
mRNA technology is used in approved COVID-19 and RSV shots, but it hasn't been approved for a flu shot yet. Medical professionals tell us the funding cuts should not impact the flu vaccine this year, but it could slow research for the vaccine in the years ahead.
It's not so much this flu season that I worry about, it's the future of what we could be missing out on if we don't continue to develop this technology.
The move from the Department of Health and Human Services is the latest reversing longtime norms. Kennedy has previously pulled back recommendations for COVID-19 shots and fired the panel that makes vaccine recommendations to the CDC. Jennifer Nuzzo is the director of the Pandemic Center at Brown University.
I do worry that this is part of an overall assault on vaccines in general. And the more the secretary goes out and impugns without any evidence vaccines and particular vaccine technologies, it just overall sows doubts about vaccines.
And these worries are starting to come to fruition. Last week, new data was released that indicates that kindergartners' vaccination rates have dropped again last year. Parents are opting out more and more around these vaccines, citing non-medical reasons. Nate.
Yeah, an expert at Johns Hopkins earlier this afternoon told me in an interview that the question of the avian flu is when, not if, it will become a pandemic. So a lot of troubling questions there. But Maura, what do medical professionals say to people who are skeptical of getting vaccines?
Well, as you just mentioned, it's concerning how these viruses could easily become pandemics, and doctors are increasingly concerned about the fact that people don't trust vaccines anymore, and they point to Health Secretary Kennedy himself for making vaccine skepticism more mainstream. And so former CDC Director Dr. Richard Besser said to Scripps News earlier that people should really seek out the doctors that they trust, the pharmacists in their community, and ask their advice, because he says most will advise that vaccines are the safest, healthiest way to fight these viruses, Nate.
Scripps News business and tech correspondent Maura Barrett. Maura, thank you for that reporting.